In England are warning that NHS cuts are putting lives at risk. They claim support for young people is effectively disappearing, as new figures suggest that early intervention schemes to help young mental health patients have been scaled back over the past 12 months. Our social affairs correspondent Michael Buchanan has this.
Katie Harrison suffers from several mental health problems, including schizophrenia. Her illness has led her to being sectioned 7 times since 2012. She believes she'd be in much better health if she'd had access to a specialist early intervention team.
As they are tailored to deal with psychosis, I believe that they could have given me coping strategies that could have perhaps curtailed it from going into full-blown hallucinations, full delusions, full psychotic episodes.
Today's report says many other patients like Katie are struggling to get the right help. It found that for the most vulnerable 14 to 35-year-olds, 50% of early intervention schemes have been cut over the past year. Some have had budget cuts of as much as 20%, while more than half lost staff.
People are having huge problems accessing services. People are waiting for a long time before they get the right kind of treatments, and that's really having a huge effect on tens of thousands of people's lives in the UK.
The cuts to early intervention schemes follow revelations in recent months that mental health beds have been reduced and children's services are under severe strain. It's all led to 6 mental health organisations coming together to warn today that budget cuts demanded by NHS England for next year, bigger than for acute hospitals, are in danger of putting lives at risk. NHS England say they've put procedures in place to ensure mental and physical health are treated equally in future. Michael Buchanan, BBC News.
With me is Stephen Dalton, Chief Executive of the Mental Health Network, one of the organisations warning against the cuts. NHS England says that these changes are ensuring that mental health is no longer in the silo that existed in the old system, and they're saying that no cuts have been made. I mean, do you accept that?
Well, cuts have been made. In fact, the BBC's own survey demonstrated that cuts have been made in mental health services to the tune of 2.3% over the last 2 years. And actually, the Department of Health's own figures show that there's a real terms cut of 1% in 2011-12.
So what they've put in the statement is wrong. I mean, it's a lie, is it?
Well, I think that what the Department of Health figures show is that, for example, older people's mental health services in 2011-12 were cut in cash terms by 3.1%. It is not correct that mental health services are not experiencing cuts. And indeed, NHS England themselves, round about the end of last year, made a real terms cut by reducing the allocation to mental health services compared to acute hospital services.
So the problem is, as far as you are concerned, and the other organisations, is that this will have an impact on saving lives.
It will definitely have an impact, and what we would hope is that local commissioners take that into account when funding services. But what we need is leadership from NHS England. I think that this is an example of what Norman Lamb calls institutional bias that exists in the NHS, and it needs to be addressed. We have ministers who are unhappy with what's happened. We have people who use services who say that they can't get into services. We have providers of services who say that they are at breaking point. And we have NHS England, year on year, reducing investment in mental health services.
But isn't the problem here that, you know, given the need for some sort of cuts, any demographic is going to complain?
Well, that's true, and I don't think that what we're asking for is a bigger slice of the cake. I think that providers of mental health services and people who use mental health services understand the economic realities. But the disease burden in this country from mental health services is about 28% of all disease in the country. The investment by the NHS is about 13%. What we need to do is see some rebalancing of that.
Why is it that this seems to be a growing problem with young people and mental health issues at the moment?
Well, I think the identification of mental health issues for young people is not entirely a bad thing, because the more we identify it, the better it is. But I think that if we look at the pressures that young people are under these days, and the expectations on them, whether it's an expectation around careers, whether it's an expectation around exams or the internet,
but
or
whatever. Are they greater now in the 21st century than they were back in the 60s or the turn of the century?
Well, I think what we have is a greater recognition these days. And so I think it's not a bad thing that we're recognising. But I think one of the things that we're seeing, which is a worrying trend, and a report out by Rethink today demonstrates there has been a cut in investment in early intervention services. These are services that are designed to actually identify young people at an early stage of their illness and to respond to them early on to stop the problem getting worse.
Right. Okay, Stephen Dalton, thank you very much for joining us on the programme.